My name's David Wortley. I'm a fellow of the Royal Society of Arts and Commerce, and one of my activities which takes a lot of my time, is digital medicine. I'm a vice president of the International Society for Digital Medicine. So I'm going to try, in as short a time as I can, to cover these topics. You may not have heard of lifestyle medicine. I didn't hear the term lifestyle medicine until about a month ago. But I've been practicing lifestyle medicine myself for the last 9 years without really knowing that was the name for it. So if you choose to exercise, if you choose your diet carefully, if you look after your body, you're probably already practicing lifestyle medicine. I'll tell you a little bit about the British Society of Lifestyle Medicine and what their 6 pillars are. And then I'll go into a bit of detail about what the problems and issues are today that make the use of technology for lifestyle medicine so important when we're tackling some of the global challenges like the aging society. And I'll show you 1 or 2 examples of how technology is used to help manage diet, exercise, and mental health before I draw a conclusion. So the definition of lifestyle medicine, according to the British Society of Lifestyle Medicine, is described as, and this is important, it's evidence-based clinical care. Whereas a lot of people will exercise and they will take care of their diet, but they don't really collect the data that will provide evidence that lifestyle medicine actually works. Behavior change is very important, and also the person-centered techniques to be able to influence behavior, and in doing so, improve mental well-being, social connection, and all these other things that you can see on the screen. So there are 3 principles behind the British Society of Lifestyle Medicine, which actually was established in 2016. And the first of these, and all of these are very important, and that is the need to acknowledge the fact that we do need to do something about it because of the different social and economic factors that determine people's health. Not everyone is in the same position to be able to look after themselves, and therefore we need to recognize that. We also need to develop and validate techniques to support people to change their behaviors and sustain lifestyle changes. And then finally, for those people who are involved in trying to evangelize lifestyle medicine, it's important to know about the 6 pillars of lifestyle medicine. Well, the 6 pillars of lifestyle medicine, so these are distinctive from pharmaceutical solutions to health, and they're really targeted at preventative healthcare rather than a lot of medical activities which revolve around interventions to improve health. So these are the 6 pillars. These are the things that are important according to the British Society of Lifestyle Medicine: healthy eating, good diet, mental well-being, healthy relationships, physical activity, avoiding the use of harmful substances like drink and alcohol, etc., and sleep. So what are the challenges really that lead to the importance of lifestyle medicine? Well, the first of these is to recognize the fact that we're all living longer. So our global average life expectancy has risen from 1800, when it was 32 years, to 70 years. And so our longevity and our lifespan has increased dramatically, especially in more recent times, say after the Second World War. The other thing that's changed is that we've been able to address a lot of infectious disease problems. So we've cured many of the things that killed people in the first part of this century. And so the causes of death today are not so much communicable diseases and infectious diseases, they are non-communicable diseases. So we die more from lifestyle-related diseases than we do from infections, even including coronavirus. The other thing that has changed in my lifetime, particularly, is the fact that more and more people are living into retirement. So this means that there are less and less people in the world to be able to support people who are retired. And so this is quite dramatic. In the United States, at the end of the Second World War, there were around 42 people working compared to one single person retired. And so you could say that it's the working population that support the lifestyles of retired people. And over these 60 or 70 years, you can see that this has gone down dramatically. In 2010, there were less than 3 working people per retired person. And this is exacerbated by the fact that it costs much more to support people when they're older because of chronic conditions that occur when you get later in life. And this graph shows how chronic conditions can substantially increase the cost of elderly care. So you see the cost, particularly people over 45 and people over 65, the costs go up depending upon the type of condition that you've got. So we're living in a world where increasingly there's a growing demand for healthcare service for older people, and more people requiring that. So a large proportion of our health services are taken up with supporting the problems of older people. So there are many different challenges, but it's our lifestyles and how these changed, with fast food, with smoking, with obesity, and changes in the family structures and family mobility all lead to these kinds of problems with elderly people. So illness, not just physical illness, but loneliness, social isolation. Many of these cause problems which lead to a burden on the healthcare. And an example of this is my partner's father, Eric Jepson. He was 95 years old when he passed away at the end of last year. And when he died, fortunately, he didn't suffer from dementia, so he didn't have any of the memory problems. But his daily drug regime, you can see on the left-hand side of the table, these were all the drugs that he was taking on a regular basis to keep him well. And it wasn't until he went on to an end-of-life daily drug regime, we can see in the top right-hand corner of the screen, that these number of drugs were reduced, simply to provide him with palliative care to reduce the pain. But this comorbidity is a real problem in today's society. And what it means is that this combination of drugs don't always work well together. And in fact, there are many deaths that arise out of the fact that people are taking drugs that don't agree with their DNA, genetic structure. My mother, this shown as an example of some of the problems of the aging society. My mother eventually died of dementia, and this is a picture of her in the local hospital. But she was a typical example of the problems of the fact that we live longer, we need more medical care as we age, we've got fewer working people to cover those costs, we rely too much on drugs and pharmaceutical solutions, which don't always agree with each other and sometimes can do harm. And the fact that with social mobility, caring for the elderly has shifted from what it used to be a family responsibility to care homes. And unfortunately, elderly care is now a poor relation of public health services because there isn't just the money, there isn't the money to support some of these things. And what's exposed this particularly is coronavirus. And it's exposed our vulnerability to the unsustainability of public health services. So what do we do about it? Well, it's the transition from cure to prevention and behavioural changes in lifestyle that are critical. And this is actually a statement from the former head of the British National Health Service. And what he said was, some years ago, it's quite clear that the best chance we have of increasing our lifespans and in overall improving our health is to address our personal behaviours, and to do so as early as possible. So what can technology do to solve the problem? Unfortunately, technology has a paradoxical effect. Technology is one of the reasons why we are living longer, because people have found cures for them. Technology is also the problem with some of the lifestyle changes. We've become we have sedentary lifestyles, not so much physical activity. And on the one hand, we could say, as many people do, don't worry that technology is going to solve all these problems and there'll be a cure for everything. People are working on cures for everything. So we just carry on enjoying our lives, knowing or thinking that it's all going to become all right with the technology. But on the other hand, you could think of technology in a more constructive way, and think of it as a way in which you can empower yourself to manage your own health better and give yourself a chance of living a longer and healthier life. The other effect of technology, particularly about younger people, is it affected what's called their locus of control. And whereas always in my life and my generation, my parents before me, we were all told that we have responsibility and we have control over our lives. We make things happen. We have the power to make things happen. But increasingly in this technological society, many young people think they don't have any control over their future. They think things that happen to them, and that's what's known as an external locus of control. So although technology is very empowering and accessible 24/7, it does make us increasingly dependent on technology, on outside forces. So this is the challenge, what I want to talk about. How can we influence lifestyle behaviours and individual circumstances, but not at an individual level, but also at cost? And my background is not clinical. I was a founding director of the Serious Games Institute, so I've been involved in games technology for many different applications. And that's how I became involved in lifestyle medicine and using technology and gamification to manage my own health, to see how I could influence my own behaviors and monitor and track them and see what happened in my life. So these are the things that I've learned over the last years being involved in this, that the key things, and pretty much in that order, I would say, for myself anyway, diet and nutrition, I will put at the top of the list. Exercise is second. When I first started out trying to manage my health, I focused on exercise. So you may have heard of the 10,000 steps rule. That's how I started. I had a smartwatch and I measured how far I walked every day. And when I first started, within 3 months, I lost 21 kilos just by walking 10,000 steps a day. But I've realized pretty much over the last 9 years that diet and nutrition are, if not even more important than exercise. But the other things that are very important in not only physical but mental well-being are hydration, sleep, the ability to manage stress, mindfulness, and also from a socio-economic point of view, it's very important to have social support of all your stakeholders in your life, your friends, your family, your employers. We can all work together. And if you don't have that support structure, it just becomes harder. So what is the role of consumer digital technologies? Well, like everything in life and like the research that we've heard about today, you need to be able to measure things. And it's digital technologies now, consumer digital technologies in the form of wearable devices, smartwatches, like the ones that I use for monitoring my own health. They are able to measure many of the things that we need to influence. But it's also important to recognize that everybody is different and we need to create our own personal benchmarks with targets that are achievable to ourselves and build that within a supporting environment. And today, and this has happened literally over the last 3 or 4 years, digital technologies are used now for therapies, not just as a way of monitoring our health and tracking things, but they can be used to influence our health. And we also need to find ways of using technology to encourage personal responsibility in looking after ourselves. So I'm sure you certainly know a lot about these things, wearable devices, smartwatches, etc. And these devices link to smartphones. So the exercise that I track, the sleep, all goes into a mobile application that presents me with a dashboard that allows me to track and monitor my health and see what effect my own interventions are. But none of these will work without artificial intelligence, 5G for fast broadband connectivity, cloud computing. Immersive technologies are important for being able to engage us in these activities, and gamification is a practice which involves the use of game psychology and mechanics to influence our behavior. So this is what it looks like from a system diagram. We have technology solutions for involving diagnostics. We have technology solutions which include AI that allow us to benchmark personal solutions. And then we have intervention solutions. And all of this goes to create our own personalized preventative healthcare services. And this is all part of an ecosystem where everyone who has some connection with you has a role to play in helping you to manage your own health. It's employers, it's insurance companies, it's increasingly banks. All of these are beginning to play more and more of a role in managing our health. So I'm going to go very quickly through some of these technologies. Now, looking at diet technologies, this is taken from a presentation I did last week on food and nutrition at a conference on food and nutrition. But I'm going to go through very quickly 3 generations of applications. The Fitbit device that I use also has recommendations for diet. So if you put in what you're eating, it will calculate your calorific intake and your macronutrients, and it'll offer recipe suggestions. But these recipe suggestions, and this is my own Fitbit dashboard from a little time ago showing how much exercise I'm doing, what I'm eating, what the calorific value of it, how's that broken down to carbs, fat and protein, and it sets you a calorie target and then gives you an idea on the things that you can eat that keep you healthy. So that's the first generation. The second generation is a mobile application that uses epigenetics. And epigenetics is a way of calculating the right kind of exercise and diet based on your own DNA. So it takes into account the characteristics of your DNA, and this originally designed for elite athletes. So it creates an optimal diet and exercise plan based on what the objectives of the athletes are. But nowadays, this technology is available for consumers, and it provides personal advice on diet, exercise, and nutrition. And these are an example of screenshots from my Moodoo application, which uses epigenetic. It tells me the things that my DNA tell me I'm vulnerable to. I'm pretty much okay on most things, but I tend to have a poor response to saturated fat. So things like hard cheeses, my body is not able to absorb and tolerate. The same with sugar. I stopped taking sugar really quite a few years ago in any of my drinks, but I'm conscious of the fact that I have a bad response to sugar, and I have a normal risk of snacking. So all of these go into providing a dashboard of health insights, which based on my DNA and my exercise, etc., will tell me what my anti-aging overview is. Unfortunately, I have a slightly faster physical design decline with age, based on my DNA. And that's probably the worst thing. And also I've got a slight risk of stress and aging. It hasn't caught up with me too much at the moment, but this creates my personal profile. And from that personal profile and information I put in about my activity level, it will give me my biological age, my eye age, my hearing age, my memory age. It will give me an opportunity to say what my targets are. And as a result of that, it will give me personalized diet and exercise. So this is the second generation. The third generation uses epigenetics and it creates a profile, but it also takes into account any medication that you're taking. And it will create an optimal diet and nutrition. And if you use it, and this is a proof of concept, by the way, it doesn't actually exist, but this is the proof of concept of where we're going. So you take, if you like, a profile of a person, Albert, high cholesterol and these different things. He takes a range of different medications. He has potential side effects. But this precision life diet advisor, the idea, this proof of concept, it will take into account all of his drug and includes comorbidity, drug interactions and so on, and drug with ingredient and allergens, all of these things. It uses in conjunction with a database of food products to be able to make personal recommendations or SWOT. And to be effective, it needs to be provided at the point of purchase. So when you're buying food, it tells this character, Albert, what he should be eating. And if he chooses something that's not so good for him, it will make a suggestion. So that I think is where we're going in the future. So it's all about personalized diet and nutrition based on epigenetics and medication, and AI and machine learning are increasingly used to be able to recognize what the nutritional value of purchased food or even cooked food. We won't have to quite type it in every time we have a meal as we do now. And in the future, I can see personalized food delivery services for both pre-cooked meals and for those companies who provide just ingredients and with a menu with instructions on how to cook it. So the second thing is exercise, just some exercise technologies. These are all based around mobile apps, and this was the very first device that I used, called a Jawbone app, and this was my dashboard. So this told me that I only had 54% sleep the previous night, but I did make 11,000 steps, and my food score wasn't so good. So over the last 9 years, I've used a range of different wearable devices and mobile apps, but they're all pretty much doing the same thing. They're representing what my physical activity and my diet are in a dashboard form that will hopefully influence my behavior. And in my case, it did. So you can see on the left-hand side of the screen what I looked like before I started on this journey. You see, I was obese. And in May 2013, when a combination of circumstances, nothing to do with any kind of ill health, led me to think, I could try to gamify my health. And you can see that within a few months, I had lost a significant amount of weight. And it didn't just affect my physical health, but it affected my mental health. So today, there are a range of technologies that make exercise fun. This is one example. This is an example application, which is primarily designed for rehabilitation. But this is another example of how I use a little exercise bike with virtual reality. And so I can start with my exercise bike.
So at this point,
It can be
I'm going to
operated by
start
my feet, or
recording a
I can
video
use
which
it
will be
on a desk
stored on the
and
Oculus
use my
Quest
arms and hands to exercise.
And now
The way that it
I
works
can
is
pedal
it's
and
linked
exercise.
to Google Street View. so I can choose where I exercise anywhere in the world. So I'm going to move on quickly because I don't have much time now. Hydration. This is a smart water bottle which shows you how far you are in your target, and when it's linked to a mobile app, will give you a little nudge, a little prompt to say it's time you had another drink. Sleep technologies, range of different devices that track sleep. This is the device I've got on the wrist, which the dashboard is shown on the right-hand side. It gives me a sleep score, and it also gives me some good advice for improving the quality of my sleep. But I have found that good hydration is a very important factor. Stress management techniques, a range of different ways that allow us to measure our stress levels and give us techniques for meditation, provide us with feedback, and encourage us to change our habits. And then finally, social support technologies, which shouldn't be ignored, and that is the technologies which help us to connect in an increasing realistic way with our friends and family. And this is an example of Facebook Portal, and particularly for older people, it's a way of connecting with family and friends from anywhere around the world that can have a positive effect on mental health. So you not only can see and talk to each other, but you can do things together. So when we're looking at healthy active aging, it's about creating new lifestyle behaviors. The technologies must be plug and play, particularly for older people. And it needs to create personalized, realistic challenges with some fun that engage not just with your immediate family, but also with the community. And none of this can be possible without the necessary feedback and diagnostics that help to motivate us and track our health. And it's all about giving users control over our health. And I speak as an older person now. I'm in the retirement age bracket. And I think one of the things that was a misconception when I was young, and still is many young people, is that we need to think of elderly people as an asset rather than a liability. And although I mentioned at the beginning that the cost of elderly care is one of the biggest burdens on healthcare services, older people do have a lot to contribute still. And if we help them to contribute to society, that not only will society benefit, but their own health and well-being will. So that is the end of my presentation. I finished exactly on the time this session was due to close, but I'm happy to answer any questions that anyone may have.